I guess what birthed the whole of this really was the death of George Floyd. And I know that one of these things that have come up that people sort of say, you know, it had such an incredible triggering effect. And people may wonder why it had a triggering effect in the UK, but it did have a particularly triggering effect, and why now rather than at any other point, when we know that there have been previous deaths in the US as well as the UK. But can I just ask you personally, how did it affect you as a person?
I think the death of George Floyd was horrifying, and as a single moment, it was horrifying. On a personal level, it was almost, I couldn't look. Actually, I have never watched the video, but it was omnipresent and on everyone's lips. And I think people have video cameras, people are being held to account for things because it's you have to believe the sight of your own eyes. And I think that people, it's very easy not to, you know about these things on an intellectual level, but it's very easy not to think about them. And I admit myself that I have never watched that video, although obviously I knew it was happening, and how long it took, and how horrific it was. I think the difference now is that because these things are widely shared and people have opinions on them and people share those opinions and thought leaders have opinions on these things, it sort of raised something that I know in my community that's been going on for such a long time about death with people in prisons, and it sort of like brought that up. And I think the feelings of people actually knowing about it and saying it's this is terrible, while good, it sort of like brought up a thing, well, this has been happening for years, this is the stuff that I know about. I have people in my family who've been in the criminal justice system. I visited prisons, I've worked in the health service for a very long time, and these things happen. So they're sort of, yes, great that people know about it, but also, yeah, this is my life, and this is my lived experience. This I've had calls from the police station. I've been there. I've been to a police station and spoken to a police officer I knew who asked me what I was doing there. And I've been stopped by the police more times than I should have been, with somebody that's got a clean driving license. So that this is my lived experience, and so it brought up all of those emotions. So some of it's anger, some of it's indignation, and and it's sort of a mixed bag of emotions, really.
Yeah, that's huge. And I think that we talk a lot about the word triggering, that these are triggering. I wonder, if we hear that word bandied around a lot, but what does it mean to you? What does it mean?
So I think, so we've had a really recent thing, even since we've organised this event, we had the Euros, I said in the chat. I live in Wembley in northwest London. I live a mile away from Wembley Stadium, and that was a fantastic event for the country. I'm quite old. I was here for the last European Championship that was held in England in 1996 with all my children. It was a fantastic event, and the whole event was wonderful, and the spirit of the England team, the things they were saying, there were issues around taking the knee. So when we talk about triggering, the whole conversation about whether the England players were going to take the knee or not, whether the manager was right, I think he was a brilliant leader in the way he wrote the letter, the way that they were consistent about it, the way they were supported, the whole team was supported by the FA. And then so that was great, that was wonderful to see, but there was a sense of unease about it, which came to pass that I couldn't even watch the final, and I live a mile away. I sort of like was sitting in a darkened room waiting for what's going to happen. I am a football fan, I support Arsenal, and and then we went to penalties, and then what happened, and I knew, and lots of people knew, that this was not going to be good, and I knew it was going to be triggering, and the outpouring the things that happened, the sort of like the violence before that affected families. I was hoping hopefully we were going to win, and I was going to be out there celebrating with everybody, but that was not how it was. It was upsetting. It wasn't good, and people were looking for someone to blame. Now, all the stuff that went before that was brilliant. It was really good. But then there's the menace, I suppose, in the back of your head. What if it doesn't go wrong? Why were the 3 people missed? Why were they black? Why did that have to happen? And the things that are triggering are like, when you see somebody murdered, or when you see somebody, you'll think you're waiting for it. You're waiting for that. What's going to happen? What's triggering is sometimes things you hear in the news. What's triggering is that's normal, and that's just affects how you use services, how you interact with people. It's a way of life. I've heard people say that about their religion and stuff like that, but sort of that lived experience is a way of life, and that can be sometimes triggering. And we're talking about the impact on mental health, and that can have an impact on mine and people in my community's mental health.
One of the things that really stood out in one of the slides was you were talking about that there's like these little microaggressions or things that people say that maybe they don't realise what it is that they're saying. Can you talk about a bit about that?
Yeah, I think so. It's when you actually look up the definition of microaggressions, there's no sort of like definition of it. It's more like a feeling. I think in the promo video for this, I talked about structural racism. I talked about all sorts of things. I talked about services. I talked about our great institutions, and I talked about you can't pinpoint anything, but it's a feeling. So I would say an example of a microaggression would be why are you always talking about race? This is a very tolerant country. It's better than America. And you should be grateful to be here. And that sort of thing. It's also a nervousness around talking about something quite fundamental to my existence, and sort of like negating it and not wanting to take it on. Now, where that comes from, and there's no intent around it, but the impact of it is sort of feeling othered, feeling that you're not part of. I was born here. I was born in the East Midlands. I've lived here all my life. I've worked since I was 15. So I'm as English as anybody else, but I don't actually feel I can call myself English. I don't actually, even though I am. So it's that sort of thing, to have that sort of like conversation, not wanting to bring those things into the conversation even. And so the things I was talking about, the Euros, that was great, because that was bringing that out there. They were having that conversation. A microaggression is somebody saying, oh, they're playing the race card, even if they're not saying it to me. That is a microaggression. In fact, no one else ever said that to me, but they wouldn't, would they? But sort of like to say that, I think sometimes social media, sometimes some commentators, they can say something and they're sort of overtly aggressive, and it's very slight. It's not overtly racist, whatever that means, but it's noted. And it's thought about. So it's almost passive aggression. So I think microaggressions, it's an interesting term, but it's sort of like being passive aggressive, but in a racial manner.
And I love what you actually said on that film, where you said, it's not so much about, it's very hard to prove, and it's very hard to prove intent, but the feeling, that was something that really sort of struck me. So feelings and mental health. What can you tell us about the impact of this? Because obviously that's the title. So the impact of this on mental health. What symptoms?
So so my feeling is that we're all leaders in health and wellbeing services, in councils, in health services, in charities, third sector. We're living our lives in our communities, and everyone's doing the best that they can. What I would say around mental health is, we talked in a sort of promo, this is around children, this is around adults, this is around all of the protected characteristics, how they how they experience experience services, how that feels for them. An example I have is, how easy is it to access mental health services? How likely is it that you will be sectioned? How likely is that you'll be given medication? How likely is it that you or your family will touch criminal justice system? How likely is it that you'll be stopped by the police? And do you have to think about that? Is that something that goes in your head at all, or do you just like, that's not your concern? I saw a film where someone said, I'm a heterosexual woman, so I don't know what it's like to be gay. So I don't even think about what it's like to be gay. Why would I? I'm heterosexual. So, and that's quite a good analogy, is that I don't have to think about that. I don't have to, before gay marriage was legislated, I didn't have to think about whether I could get married in a church or anywhere else. It wasn't a thing on my thing. But so that's the same for, accessing any services legally in schools. I don't have to think about the curriculum. Do I have to think about the curriculum? Yeah, I do. So, what's important, who is legislating and what's important to them and who does it help? I think so in our services, are we listening to the people using them? Is there a representation of our communities in the leadership positions in our services? So when a person from that community uses your service, that they are reassured. I can tell you that I have, I worked as a nurse. I touched people, but I worked as a manager in the healthcare for a long time. But when I was working on a ward, I know some people were reassured that if I was there, and I felt reassured if they were there. If you go into a police station and you see somebody who looks like you, if you go into a hospital and the consultant looks like you, that's reassuring. And so, do we know what our services are like, what the experiences are for people that don't look like us, that are, do we know? Have we asked them what that's like? And so that's the impact, really. Do we know whether they even use your service? Do they trust, we're in COVID-19, when we've got vaccine hesitancy, and, there's lots of different reasons for vaccine hesitancy, but I know in my community, the reasons are different, and it's around whether they trust the health services or not. And that's painful for me, actually, having been born and bred, being a nurse, girl and woman, but, there are reasons for that. And then, so people sometimes say, well, around jobs, well, we advertise these things, but no one applies. And I'm thinking, well, why don't they apply? Is it accessible? Are they encouraged to apply? Or is it, the people in the positions of power and the positions, they don't look like you, and it doesn't look like that it's accessible to you or not? So I think, and those sort of things, knowing that you're not likely to get a job, whether that's the truth or not. So do we know our data around that? Feeling that there's no point in applying because you're not going to get it, that you're going to be stopped by the police. That's not good. That if you've got a nice car, and this has happened to me personally, I've got a very nice car, that you'll be stopped because you've got a nice car and people don't expect you to be driving it. So that sort of thing does have an impact on, and it makes you very angry, and then that might turn into a mental health concern. And then the thing is, that can you access those services? Who's there to support you to do that?